Hi, my name is Kaitlyn and I'm studying orthoptics at La Trobe University. We are going to demonstrate how to test contrast sensitivity using the sine wave contrast sensitivity test, as well as the interpretation of its results. Contrast sensitivity measures the limit of visibility of low contrast patterns. In other words, it measures an individual's ability to distinguish between finer and finer increments of light versus dark. How faded can an image become before we are no longer able to see it? This is different from the common visual acuity, which measures an individual's ability to recognize smaller and smaller letters on an eye chart, such as the Snellen chart. Using these low contrast images, contrast sensitivity can detect subtle changes in vision that are hidden by acuity. This can be very useful clinically for the evaluation of ocular diseases such as cataracts, glaucoma, optic neuritis, diabetes, and macular degeneration. Contrast sensitivity is based on the principle of spatial frequency, which is variations in luminance across space. A sine wave grating is a simple stimulus which can help us understand the complex concepts of spatial vision. The sine wave grating and its luminance profile is shown here. The image above with the bright and dark bars refers to the sine wave grating, and the image below is the luminance profile. As it can be seen from the image, the grating has alternating bright and dark bars. The peak of the luminance profile corresponds to the bright bar of the grating, and the dark bar corresponds to the depressions on the luminance profile. Here are two gratings. As it can be seen, there are more cycles, or in other words, alterations between black and white in the left compared to the right. Therefore, it has a high spatial frequency, and the one on the right has a lower spatial frequency. The dashed lines across the luminance profile gives the average luminances of the gratings. The average luminance is the same for both gratings, but the one on the right has a larger difference between its peaks and the average luminance value. Therefore, this indicates that it has a higher contrast. The pros of contrast sensitivity testing. It allows a thorough, complete investigation of visual function rather than just assessing visual acuity. This may assist in detecting visual problems at an earlier stage. It stimulates what the real world is like and the difficulties that patients may face in situations where contrast sensitivity is low. Individuals have good visual acuity when assessed with a Snellen chart, but they may be experiencing difficulty with contrast. It can assist in detecting changes in visual function over time, and it can help predict illumination, contrast, and magnification needs if the patient are experiencing reduced contrast sensitivity. The cons of contrast sensitivity are: it relies on the patient's subjective response. It is difficult to maintain equal illumination across the entire chart. In some instances, the illumination of the room can be difficult to control, particularly if there's a window. This can add glare. This may result in inconsistencies when testing the patient, and it's time consuming. Now, the test performed today is a sine wave contrast sensitivity test. We're using the VizTech chart, which is a large chart against a wall. It's arranged in 5 rows with 9 circular patches of varying contrast levels. The gratings include 1.5, 3, 6, 12, and 18 cycles per degree. The gratings within the patches are orientated vertically or 15 degrees to the left or right. When performing the test, the chart should be uniformly lit at a normal room lighting with no glare, and positioned 3 meters away from the patient. The bottom of the chart has demonstration patches, which can be used as an example to explain the positioning of the gratings if the patient has not performed the test before. During the testing, the patient will indicate to the clinician the last patch that they are able to see, and in this instant, the clinician will ask the patient to describe the orientation of the lines.
Sure. So Kaitlyn, I have a referral from your doctor saying you're noticing your vision is a bit hazy, is that correct?
Yeah, particularly at night.
Okay, so we're just going to perform a sine wave contrast sensitivity test. Have you ever done one of these before?
No.
Okay, that's okay. I'll just explain it to you quickly. So these are the demonstration patches at the bottom. There's 3 of them. One of them, the gradings is going to the right, one of the gradings is going straight up, and the last one, the grading is pointing to the left. Do you have any questions?
No.
Okay, so we'll just start by reading this like a book, starting on row A, and then you just tell me which way you think the gradings are facing.
Yeah. Left, up, left, right, and I can't tell 7.
Okay, so going back to the patch on the left.
Right.
Okay, and then number 7, or you can't see that?
I can't really tell.
Okay, that's okay. Now moving on to row B.
Right, left, right, up. And I'm not sure about the next one.
Okay, now going back to the patch on the left to confirm it.
Yeah, up.
And then the one after.
Maybe up, but I'm not sure.
Okay, that's alright. So we'll just continue to row C.
Up, right, left, up, right, up. And I'm not sure about the next one. To plot the results from the test on the recording sheet, it is compared to a normal contrast sensitivity curve. Determine which is the lowest contrast threshold that your patient can detect for each row out of the 9 gradings. Then join the dots in each column to create the curve. The grey shaded area indicates the normal range. Patches above the grey area means the patient has heightened contrast sensitivity, while the patches below indicate the patient falls outside the normal range and has reduced contrast sensitivity threshold. Patients who score below the normal range should be considered for other pathologies. In the picture here, the red line indicates the right eye. The black line indicates the left eye. As you can see, the patient's left eye has a better contrast sensitivity than the right eye. This means the left eye is able to determine finer changes in the gradings than the right eye. This patient falls outside of the normal range in columns A and C. If the patient is outside the normal range, this could indicate diseases such as glaucoma, cataracts, or diabetic retinopathy, although this requires further investigation using other tests and history taking. Spatial frequency refers to the different sizes between the light and dark lines / gradings. The lower the spatial frequency, the larger the width of the gradings. This demonstrates less cycles per degree. In terms of functional vision loss and interpreting the results from the patient, it is generally an indication of more functional vision loss if the patient has reduced results with the gradings of low to medium cycles per degree or spatial frequency. As an everyday example of low spatial frequency object, this could be a bus on the road. Therefore, it is quite debilitating for a patient to have reduced contrast sensitivity in low spatial frequency compared to high spatial frequency, as a high spatial frequency refers to more visual acuity. This could be seeing the number on the bus. What does this mean for patients experiencing contrast sensitivity loss? Increased risks of falls / bumping into objects, especially in older individuals. Difficulty reading low contrast text. The world seems washed out or hazy. Driving at night is more challenging. Judging distances gets harder. Problems with recognizing faces. Navigating in unfamiliar environments is difficult. But how can this be improved? Here is an example of how varying contrast levels can assist those experiencing contrast sensitivity loss. In this picture, we have escalators with highlighted yellow on the edges, and then we have plain stairs. The edges with yellow are visually more obvious than the stairs without yellow. This can make a significant difference to patients experiencing reduced contrast sensitivity and may prevent falls and other injuries. In the next picture, we can improve functionality by performing activities on a high contrast background. For example, instead of chopping something red on a red background, which has low contrast, The patient could chop a red tomato on a green background to improve contrast levels and therefore visibility.